What parts of the head cause headache pain? Imagine a headache as a signal from your body warning you that something might need attention. But the brain itself doesn't feel pain because it lacks pain receptors. Instead, the pain comes from structures around and within the head that are sensitive to pain signals. These include several key areas. First, the skin, muscles, and tissues on the scalp and head are rich in pain receptors. When muscles tighten or tissues become inflamed, they can send pain signals that feel like a headache. The arteries outside the brain, called extracranial arteries, and the membrane covering the skull bones, known as the periosteum, are also sensitive to pain. If these structures become irritated or inflamed, they can produce headache pain. The jaw joint, called the temporomandibular joint, can also contribute, especially if there's dysfunction or muscle tension around it. Tension in the muscles of the neck and upper cervical spine, which includes the first 3 neck vertebrae, often plays a role in headaches, especially those that start in the neck and radiate to the head. These muscles and nerves can become tense or irritated, leading to pain that feels like a headache. Moving deeper inside the skull, the meninges are protective membranes that surround the brain and spinal cord. The outer layer, called the dura mater, and the inner layer, called the pia mater, are sensitive to pain. When these membranes are stretched, inflamed, or irritated, they can cause sharp, intense headaches. Small blood vessels within these membranes can also be pain-sensitive, especially if they dilate or become inflamed. Blood vessels in and around the brain are another major source of headache pain. During migraines or other headache types, these vessels may swell or dilate, which can activate nerve fibers that transmit pain signals. These nerve fibers are mainly from the trigeminal nerve, which has branches that serve the face and head, and from upper cervical nerves. When these nerves are irritated or inflamed, they send signals that the brain interprets as pain. The trigeminal nerve, especially its ophthalmic and mandibular branches, is a key player in headache pain. Nerves from the upper cervical spine, specifically from the 1st to 3rd cervical nerves, also contribute, especially in headaches related to neck issues. In the context of brain tumors or other brain health concerns, headaches can occur because these structures are affected by pressure, swelling, or irritation. For example, a tumor pressing on the meninges or blood vessels can trigger headache symptoms. Recognizing which parts are involved helps doctors determine the cause and choose the right treatment. So, in summary, headache pain mainly comes from irritation or dysfunction of tissues around the head and neck, like the scalp muscles, skull covering, meninges, blood vessels, and nerves such as the trigeminal and upper cervical nerves. The brain tissue itself does not directly cause pain. Understanding these areas is essential for evaluating headaches, especially when considering serious causes like brain tumors. If you experience frequent or severe headaches, it is always best to consult a healthcare professional for proper diagnosis and care.